Good afternoon, everyone, and thank you for coming. I'm Erin Schumaker, Senior Healthy Living Editor at the Huffington Post. I am also today's moderator. Today, just days before Earth Day, we're talking about America's drinking water with a focus on lead. Where do we stand more than a year after Flint? Are other cities at risk for contaminated water? And why are children in particular at risk for adverse health effects from toxic water? This event is presented jointly with the Huffington Post. It's streaming live on the Forum and the Huffington Post websites. It's also streaming on Facebook. Our panelists, starting from my immediate right, are Jeffrey Griffiths. He's the professor of public health and community medicine at Tufts University School of Medicine. He's also former chair of the U.S. EPA Drinking Water Committee Science Advisory Board. We have Stephen Estes-Smargiassi, Director of Planning and Sustainability at the Massachusetts Water Resources Authority. And we have Eric Feigl-Ding, epidemiologist at the Harvard T. Chan School of Public Health and founder of toxinalert.org. Joining us remotely, we have Moitrey Mazumdar. And Moitrey is a pediatric neurologist at Boston Children's Hospital. The program will include a brief Q&A, and you can email your questions to the forum at hsph.harvard.edu. You can also participate in a live chat that's happening on the forum website right now. Let's begin. Most of you are aware that toxic lead levels were detected in Flint, Michigan's water in 2015. Let's take a look at a video clip from the ACLU of Michigan.
The narrative that they're using to get us to sit down and be comfortable with this situation is that the water is safe.
But the water was not safe.
In April, beginning of April, we found out my child had lead poisoning.
Lead is a powerful neurotoxin. Childhood exposure to lead results in IQ loss, behavioral problems, and learning disability, all of which can push young kids into the school-to-prison pipeline. For children and adults alike, lead can cause extensive harm to almost every organ or system in the body, especially the central nervous system. Perhaps most disturbing of all is that the impact of lead exposure can be passed from one generation to the next.
I'm terrified of what, the outcome of this, the aftermath of this could be neurologically for my children.
Jeffrey, you used to chair the EPA's Drinking Water Committee Science Advisory Board. Can you give us a big picture about how safe the U.S. Drinking water supply is?
Sure, thanks very much. The drinking water supply in the United States is, by most definitions, safe. It doesn't mean that it can't be improved, but it's safe. I drink tap water at the house. I don't use any special kind of filtration or things like that because it's not necessary. Having said that, it doesn't mean that we don't know of issues like lead. And in particular, if your community has high lead levels or if your house does, this is no joke and it's something that needs to be taken care of. Let me just start so we're all on the safe page, and that is that there is no such thing as a safe level of lead. Lead's bad for you. If it turns out that the lead in your house is lower than the action level that was determined first some decades ago in terms of regulatory agencies, it doesn't mean that it's safe. What it means is it's safer than a high lead level. And the action levels that were determined by the regulatory agencies were to cream off the crop, to cream off the top of the most risky houses or areas being served by water. So remember, no safe level of lead in water. Now, historically, what we've seen is a big decrease in lead levels in kids in the United States, and in adults too, but also in kids. And so that's mostly due to things like removing lead from gasoline and also from paint. It doesn't mean that we've done necessarily as thorough a job with pipes that are built into the ground that we can't see and that lead into your house. There's a very poor understanding at the granular level, at your household level, in terms of what lead exposures you may have. And that's because even if a utility which owns the pipes in the streets does not have lead, it doesn't mean that you don't have lead going into your house from those pipes. You own those pipes. And the pipes inside your house could have lead in them as well, as could the fixtures. So we don't really have a good understanding of that because in many ways responsibility is divided between the water utility in the street and then your house, because you're responsible for your house. An important part to this is an understanding that the infrastructure for water in the United States is really going down the tubes. And by that I mean it's old, it needs to be fixed. There's a lot we don't know about where there are problems. There are some utilities that are more on top of this than others. But the infrastructure issues that we see with highways, airports, telecoms, all this kind of stuff, it's the same thing, except if anything, the infrastructure for water delivery is worse off because it's buried in the ground and nobody wants to deal with it, right? And when you go to a particular town, you know, the cops, the fire, the school, that kind of stuff is an immediate need. The pipes in the ground, will wait a little bit longer on that. Maybe we won't fund any infrastructure there and stuff like that. Well, this is now gathered speed, and now it's a really huge problem. And so in the same way that we're concerned about infrastructure, we need to worry about that. One of the things I want to say is when it comes to infrastructure, there's a very specific issue which has arisen, which is lead exposures in schools. Now, if you really want to make your kids stupid and you really want them to have health problems, why don't you make sure that they get offered water with lead at school? That's really, from a societal point of view, about as stupid as you can get. And so there's a lot that you'll read about school-based lead exposures, and I hope you pay a lot of attention, and I hope that all of you who have kids at school are going to be looking into this yourself and finding out what you can about this. There are many schools that are 50, 60, 70 years old infrastructure, and what are those bubblers? They may have lead leading into them. So this is something which is a hot issue, and I think it's a totally appropriate issue. Having said all of that, from my point of view, this is a massive story of political failure of leadership. This is not a political issue. This is not a Republican, Democrat, anarchist, or socialist one. This is a public health issue, and it's a symptom of our failure to be able to unite around obvious stuff that needs to be dealt with, from my point of view. So maybe later I'll talk a little bit more about the failure of political leadership that's involved in this, but let me stop right there.
Thank you. Stephen, as a director of a state water authority, you need to grapple with practical issues of safeguarding drinking water supplies. Can you share some of your thoughts on that?
Sure. That's a great introduction by Jeff, and I'd say I agree with him generally. I drink tap water. Generally, our water supply is pretty safe. We've made huge progress in reducing lead levels in most systems around the country in the last 20 or 25 years. Here in the Boston area, we've seen a 90% reduction in lead levels in homes with the highest risk, homes with those lead service lines that Jeff mentioned. It's important to realize there's not lead in our source water in most communities. There's no lead in the pipes in the street. The lead's there, and you may remember this from your high school chemistry, I hope in an audience here, that lead's the universal solvent. It wants to dissolve any metal that it's in contact with. Water. Thank you. Water is the universal solvent. It wants to dissolve any metal it's in contact with, including lead. If you've got an old home, you may have a lead service line connecting the water main in the street to your home. You could have brass fixtures in the home. Lead service lines weren't installed after World War II mostly, but up until 2011, Congress said that lead-free is up to 8% lead and brass. So if you installed a new faucet thinking it was best thing since sliced bread, it could still be leaching lead into your water if that water sat stagnant for an extended period. So we, the water industry, share responsibility with the homeowners for dealing with this problem. We do what we can to make the water less corrosive. That's why we saw a 90% reduction in our lead levels here in the Boston area. Homeowners also need to be aware of the issue and do what they can, and we'll talk more about that. Kids are better off than they used to be. That's great, but there's still work to do. We still have some lead in our water. There's still some lead in kids' blood. We'd like to see both of those as close to zero as we can. So that remaining risk can't be ignored. Can't rest on our laurels. 90% reduction in kids' blood levels is great, but children still have lead in their blood. This is a lot of our conversation comes up after Flint. What happened in Flint? Well, a firestorm of things that went wrong. In the risk business, we often talk about the Swiss cheese metaphor. You can imagine you've got one piece of Swiss cheese, you can stick your finger through a hole. If you've got two pieces, the holes probably don't line up. 3, 4, 5, 6 pieces, pretty unlikely that the holes will line up. But if they do line up, you can stick that pencil or your finger right through all 6 layers. We try in the water business to have all these layers of protection, multiple barriers in treatment, multiple barriers in source protection, layers of regulation at the state and local level, so they don't line up. But in Flint, they did. Changed their source water, didn't do a good job on corrosion control in their treatment. They had about half of the homes had lead service lines. Money was more important to the emergency manager than people were. That's pretty clear from the evidence. State regulators could have picked up on this, but fell down on the job. Maybe worse than that. We'll see what happens to those who were indicted. And the federal regulators could have picked up the problem, but didn't until quite late. All of those things, that firestorm of events, resulted in really awful water quality. Well, it shouldn't have happened. The science is clear. If you don't do corrosion control and you add a corrosive water, you're going to have lead in the tap water. Regulations are clear. Flint should have been doing corrosion control. They weren't. The problem was in plain sight. The water didn't look like this. It was bright red. Every time I show a picture of that, I'm astonished that it didn't cause the whole system to shut down to say there's a problem here, we need to fix it. So everything that could have gone wrong did go wrong, both in the physical sense and in the regulatory safeguard sense. So I like to say let no crisis go unused. In our business, crises generate interest, they generate enthusiasm, they generate political will. Maybe we'll have some political will now. It's been hard to make an argument for assets that are buried in the ground, especially if they work. You turn on the tap and the water comes out. Here in the Boston area, it's great, it's cold, it's clear, it's tasty, but it's hard to get people to realize that it's going through pipes that could be 150 years old, and that their home could have pipes that might be causing them a problem. But across the country, post-Flint, lead service lines are being replaced. Here in Boston, we're seeing a lot of that going on. Consumers know more about lead and are paying more attention. They're asking questions, not just about their school, but about their home. And there's an opportunity for us to deal with this aging infrastructure. We can take that. There's a possibility that people will be willing to make a little bit of extra investment, both on the public side, in the streets, and on the private side, in their homes. Here in the Boston area, our board of directors at the MWRA allocated $100 million to deal with lead service lines post-Flint. Something we thought needed to be done. We wanted to make sure that cost was not an excuse for local governments not to ask.
Right, I hope other cities follow suit. For a more personal perspective, we are going to turn to Moitre remotely. Moitre, you treat children who've been exposed to lead. Why is lead exposure so harmful to kids?
So I think that the focus on children and children's health is entirely appropriate when we talk about lead poisoning or lead exposure through drinking water. I'm a pediatric neurologist. You know, what we focus on is the brain development of children, because it's a very complex process that starts during pregnancy and really goes through adolescence. And it's a complex process where synapses, which are the connections between different parts of brains, are formed, they're selected, they're modified. And there's evidence, a wealth of evidence, both in humans and in animal models and many other experimental models, that lead disrupts many of these very important processes of brain development. Because children's brains are growing and making connections, important connections, disruption at this time period is more harmful, and the results are more long-lasting. There's evidence lead is certainly harmful to adults, and lead exposures in adulthood are also important and also not good. But there's more evidence that that kind of exposure is reversible if the lead, the source of exposure, is taken away. Children, that seems not to be so, and it's because it's affecting the very fundamental processes of brain development. This is not a matter of scientific question anymore. I think it's important to emphasize that. There's overwhelming evidence that lead exposure at various levels, high levels and even levels, in the range of what we saw in Flint and other communities, are harmful. And the best or the most studied outcome is IQ, is a measure, sort of a broad measure of of cognitive and function. But there are other outcomes that have been associated with lead exposure in childhood, including behavior, academic achievement, even socioeconomic status. And a very important study that's recently come out is one from New Zealand, which has shown after 30 years, almost 30 years of follow-up of children who were exposed in late childhood, that children had poor academic achievement and poor socioeconomic status. It could be associated directly with the lead exposure. What was interesting about that study was that it didn't, this was a community in which there weren't associations between other factors that affect these outcomes and lead exposure at the beginning. So in the US, we often say, well, we know that lead is associated with lower socioeconomic status, with race, with poor educational opportunities at the beginning. And so sometimes there's an argument that, what we're measuring is not lead, it's the factor, these other factors. But I think we have evidence to show that really it's lead that's toxic, this chemical itself. You asked me what we see in Boston, and what we see in Boston, we still see lead poisoning in children, and at levels that are very high, in lead levels in 30s or 40s and 50s. And most of those children we find are exposed through lead paint and not through water. And I think it's important, even though the focus of this conversation is about lead in the water, to remember that in communities such as Boston and other cities around the world, including Flint and other cities in Michigan, the lead paint is still a very important source of lead exposure to children. And that maybe where kids really get these high exposures that we know for sure are very detrimental to their outcomes in adulthood. All right. So I think the message is, these are permanent, these are high, these are present, and we know the science really supports that prevention is the answer and not mitigation. We really need to echo what the other speaker said. Really, it's a matter of political will. If we can get it, we know when we need to act and who's the most one.
Thank you, Moitre. Eric, you're an epidemiologist. How did you get into lead in particular?
Well, epidemiology was originally founded when the cholera epidemic in London it was stopped when John Snow, removed the pump handle and stopped the cholera being spread during the wells there. So epidemiology has always been chasing basically what's in the water for a long time. And it was because of all the regulatory failures and the government failures and the local Flint failures. After last year, I was thinking, we have to do something about this. Because in all other areas of health, say obesity, diabetes, high blood pressure, heart disease, there's medicines for all these cholesterol, blood pressure, blood sugar, and there's lifestyle and there's diet. And even if you don't prevent it, there's treatments. But for lead, the brain damage that Moitre mentioned in children is permanent. And I think not many people realize that. There is no treatment. For a child that's lead poisoned, they are lead poisoned and IQ and cognitive poisoned forever. And so in that context, the prevention is the only thing you can do. But at the same time, how do you prevent something like this if most people have absolutely no idea what their water toxicity level is? What do they do? Where do they turn? Well, if you turn to the EPA, you'll probably spend half an hour, over an hour, and it's very unlikely you'll find the answers of what your lead levels are. And that's extremely frustrating. And if you have wells, then you can't find any there at all. And U.S. Geological Survey, it's almost very difficult as well. And nationwide, the NRDC says there's 18 million Americans drinking lead-contaminated, high lead level waters. And USA Today puts that at 2,000 water systems in America. These are just cities. These are not rural areas. And there's actually 4 million people living in rural areas that are completely outside of city water departments that even test them whatsoever. So there's a huge amount. And again, at the 15 parts per billion EPA action level, that is just the tip. Boston, if you actually look at the lead levels, Boston reports actually lead levels around 10 parts per billion. And scientists already agreed 10 parts per billion is very toxic. FDA regulates bottled water has to have less than 5 parts per billion. Boston is actually double that. And in East Boston, the communities in East Boston by the airport actually exceed 15 in their waters. It's red, basically. But the impossible thing is, people don't have the time to follow this. How do we even find out about this? And this is something that affects generations. So it's not just, even if you're drinking absolutely crystal clear water with no lead whatsoever and no lead in your blood whatsoever, and you go to Whole Foods and you eat organic, if you were actually exposed when you're a child or a teenager, as a mother, as a woman, the lead actually gets sequestered away into your bones. And you could be completely normal. But when it's time for a mother to have a child, and she basically starts cannibalizing all the stored calcium in her bones to grow the baby, all the lead from her childhood exposures from 10, 20, 30 years ago starts leaching out and getting into the children. So this is something that is generationally cascading. It's a pernicious thing. And if we don't prevent it now, our children will be harmed forever, and our children's children will be harmed forever. So that's why we decided, look, the data is almost impossible to access, and then again, almost really, really impossible to keep up with, because water changes. So what we did was, we rallied a group of scientists and engineers, and we built a platform, a public geosocial network platform that aggregates all the data from the EPA and U.S. Geological Survey, and we created an alert system, kind of as our solution, grassroots solution to solving this crisis and preventing it if governments are not yet able to step up. And so I just wanted to quickly show you that the video describes toxinalert.org.
Water is our most sacred natural resource. But how would you know if your tap water is contaminated? How would you know if water in your schools and neighborhoods are polluted? And if you knew, how could you alert your community? How can you directly make a difference? Toxin Alert is the first ever nationwide social network and alert system for water. Founded by public health scientists from Harvard and a team of parents and engineers, our mission is to empower citizens to protect our children's health. We provide the latest water quality data from EPA and other agencies, combined with lab-certified tests of water samples sent from a network of active citizens like you. You'll receive up-to-date critical alerts of potential water hazards near you and gain the power to alert your community. Join Toxin Alert and help us prevent future tragedies together. With your support, we can help make sure it will never happen again. Let's do it for our children and their future.
So we just heard about an innovative way to empower and communicate with the public about drinking water risks. Stephen, that's part of what the MWRA does. What concerns do you typically hear from the public, and how do you respond to them?
We hear things come in through the website, they come in from telephone, people send us letters. The most frequent we get are folks calling, frequently new moms. So when I talk to a customer, I want them to know a couple of things. I want them to be knowledgeable about all their lead risks. As Moishe said, we need to think about lead paint, lead dust, and lead in water. We don't want to misdirect someone and get them to thinking that there's only one issue they should think about. We want them to learn how to manage that risk, but we don't want them to be scared of tap water. Drinking water is part of a healthy lifestyle. You need to be able to be comfortable with that. So what kind of things do we tell them? We tell them, be alert, have your water tested. Every house is unique. Knowing what the level is across the whole city in high-risk homes doesn't tell you if you have a high-risk home, it doesn't tell you what the level is in your home. If you really want to know about your tap water, you have to have it tested there. We provide that information on our website. You can actually go and find a lab and take care of it. Some cities actually provide the service for free. We don't do that here in Boston yet. If the water hasn't been consumed for a while, we say, look, fresh water is better than stale. It works for vegetables, works for tap water. If the water hasn't been used for a few hours, it's more likely that if you have any lead in your piping material, that lead service line that Jeff mentioned or the brass that I talked about, that it could have lead in it. So we say don't use stale water, use fresh water. Flush the toilet, take a shower, run the water in the kitchen for a bit until after it's cold. That water's coming out of the main. You don't have to waste water to do it, but if you think about it. And in particular, we're really careful with folks who have infants that if you're making baby bottles, use cold water, use fresh water, not stale. Don't use hot water. Hot water is always going to have more lead in it. It's been sitting in the pipes warm, it's going to dissolve more lead. There's a temptation in the middle of the night to use the tap water right from the hot water tap to make that bottle rather than wait to put it in a pan and warm it up, but don't do that. And we tell them to pay attention. Find out if they have a lead service line, and if they do, work with their utility to get it out, and look for their annual water quality report and get some of the information that's hard to get on the website, but that every utility has to mail to your home. And then call us up if they have questions. My experience has been almost every water department's happy to answer questions if a consumer calls with real questions. Be polite, call up, ask us questions.
Right. I do have to wonder, with the recommendation to run water, though, how does that jive with what we're all kind of the water conservation and environmental recommendations that we're getting from almost every channel right now?
So we say use water for other purposes first. Wash dishes in the kitchen, fill up a water bottle for your plants, then you've got fresh water. And if you're in a situation where you're more concerned about conservation, fill up a pitcher when the water's fresh, put it in the refrigerator, and then the next time you come back to the kitchen, 4 or 5 hours later, you don't need fresh water out of the tap. You can use the water out of your refrigerator.
Right.
You don't need to waste water to have good water.
So it's going to take a little bit of extra effort, but obviously not having lead poisoning is worth it.
Exactly.
And then I want to put this kind of on a big picture look. Where do we stand in the face of the current administration's proposed EPA budget cuts? Jeffrey, maybe you can speak to this. Are any of you worried about that we could undo some of the gains that we've made?
Well, it's interesting from an historical point of view, and everyone's got a little bit different take on this, but remember that the EPA was the creation of a Republican administration with bipartisan support because of the recognition this was a public health issue and this was not a political issue. And so the EPA has gone through its ups and downs and so forth like that. But before we come to the current administration, don't forget that Congress cut the EPA's budget by on the order of 20% just a few years ago. And so now the proposition is that we're going to cut it by, 30%. So we're probably looking at an EPA that's less than half the size of what it was 8-10 years ago. Now it's interesting because people, in my experience, they say, oh, the EPA will take care of that. The EPA needs funds to do things as well. They need that both to do research and they also need it to conduct regulatory oversight. A lot of people don't know this, but the EPA is at the federal level and the states are down here and the states are what implement the regulations. Now, there's a few exceptions to that that have to do with Native American sites in a few states which have kind of given up on doing anything. But so this is called primacy. So the EPA sits up here and everybody refers to the EPA as a source of guidance and things like that. They're supposed to be where the expertise lies. And if a state fails, like Michigan did, the EPA is supposed to be able to step in. Now, of course, I just would remind you that in Michigan, when they failed, the CDC, for example, was called in to deal with a concurrent epidemic of Legionella, but Michigan said, no, we don't need your help. So there is this kind of need to have a strong EPA that's able to deal with these common public health, common sense problems that we have. So I'm actually quite pessimistic that we're going to have anything remotely at the same kind of level of things. I mean, if the EPA makes it through this period of low support, I think that what we're going to see is the guidance of the last decade being projected forward. But do I see any far-sighted kind of stuff around, for example, mapping where the lead risk is, and then the pressure to to do this that's pushed by the EPA to the state and then the local level, I think that that's unlikely. And so I'm really very concerned about that.
Right, yeah. I'd be curious to hear what you think, Eric. Obviously, your website seeks to fill that gap in some ways, but...
Right, so EPA is one of the cornerstones of the data, but it's not the only. EPA actually, they have a division that actually enforces those who exceed the EPA action level. It's their ECHO enforcement database. And oftentimes I already noticed in data that there's high lead levels, but there's actually no enforcement flag that's been instituted by the EPA. And I think when you cut an agency by 31%, even if all the staffing is still maintained for water, I think the enforcement capability will be much diminished. And also the updating of data, I think also U.S. Geological Survey will need to step up a lot of their sampling of groundwater, which is very susceptible to fracking, for example, and other runoff contaminants that a lot of rural America is entirely dependent on, and which right now is a completely black box. So EPA can only play with the cities that do report, and also many cities, if they're small to rural towns, they only do testing once every 2, 3, 5 to 7 years, once every that long of a period. And right now, I could see so much of those testing and also enforcement of these regulations falling by the wayside. And so I think for the states, I actually think for Michigan, instead of basically kicking the can around, we need really, really good leadership on the state level. And that's why I'm actually very proud that the Detroit City, a former city health commissioner, Dr. Abdul El Said, is actually running for governor because you really need public health leadership to solve these kind of issues. And for Michigan, I think that's what we really need.
As a citizen, I'd say infrastructure has frequently been funded locally. And so the real pressure point as a water supplier comes from our customers. So EPA is great for setting guidance and doing research, and they have moved the ball forward in the decades since the Safe Drinking Water Act was first passed and EPA was first created. But real decisions on whether investment is made in water are made at town meeting. They're made at city council. They're made at the water board, and they're made because customers, citizens say, we want to have better water. So get your water quality report. If you don't like it, if the data on Eric's website doesn't please you, talk to your local folks, because even without EPA, progress can be made locally. I want EPA to be strong, but local actions it's where the rubber hits the road ultimately. And EPA doesn't give us money for water pipes.
And I think local cities contributing their own data beyond, instead of local cities reporting to the state, reporting to FDA, if they directly report to a centralized database like Toxin Alert, which is entirely nonprofit, and local citizens getting involved, we can fill in some of those gaps where EPA will drop the ball in the coming future.
So I would be curious, do either of you have examples of some cities that are doing this really well, some local governments that are maybe the gold standard that some of the Flint, Michigans of the world should kind of look to?
I'm not a water regulatory, but I've seen that there are a lot of cities that do update regularly to the EPA and other states, but also other cities that do not. I don't want to name them any names, but Boston could also test more than 25 samples a year for the entire city of Boston. And I know that, and New York can sample more than 100 sample for the entire city of New York City. But I know they have very great public health departments, and I know many people in them, but I think raising the profile of water in these health departments and water departments together would be really critical.
Give me some good examples. Lansing, Michigan. We've talked a lot about Michigan dropping the ball. Individual cities in Michigan haven't dropped the ball. Lansing made a decision quite a few years ago that they were going to remove all their lead service lines. They went ahead, they paid for it locally, came out of their water bills. They've eliminated every single one of those. Excellent progress. A number of cities around the country have done great things with getting information out there. Boston has an interactive GIS map, has had it for a number of years, where you can type in your address, find out whether you've got a lead service line, see if your neighbors have lead service lines. If you want to buy a house, see if it has one. That's been duplicated around the country in Cincinnati and a number of other places. Folks also have pushed more for data. New York collects a small number of samples as required by law, but they also collect tens of thousands of samples around the city voluntarily for homeowners who are interested in knowing about their own individual lead levels. Because as I said earlier, knowing what happens in the city is interesting, but I really want to know what's happening in my house for water my kids drink. So not necessarily that worst case overnight stagnant sample that EPA requires the test, but what about when the kids come home from school and fill up a glass of water? What's that one like? Well, I suggest when a homeowner calls me up to ask, I said, well, just before you fill up the glass of water your kid was going to drink, fill up the testing bottle and send it into the lab. Now you know what the real answer is. So there's positive stuff going on.
Absolutely. Did you have a comment you wanted to add?
Well, I wanted to make a comment about the kind of data that's out there too, and the kind of information. Historically, what was collected at the state and then the federal level was often not the exact number that your water tests at. So let's say your test is 14.5 and 15 is the action level. That would be okay. And so if somebody next to you is 15.1, that would be an exceedance. And so what gets reported would be one exceedance and one okay. And so one of the reasons why we're still grappling with this, and we're kind of really behind this, 30, 40 years behind where I think we should be, is because that's the kind of level of information that gets kicked up the system. So when you go into databases, often it just has, didn't meet or did meet requirements. So I'll give you an example that if you read the newspapers in Portland, Oregon, Oregon's been running average tested levels sometimes in the 14.9 region in some parts of the city for quite some time. And it had been higher than that, but then they adjusted where the risk was going to be assessed. And so now it's running just under 15. And so allegations have been made that they've been fiddling the data. I'm not trying to say they have, I'm just trying to say that's what's
And legally, they can toss out the highest 10%. So if out of 100 samples, 10 actually exceed 15, and the 90th actually does not, they don't have to report any of the top 10.
So the business about actually having real information.
I'm going to interrupt though. Eric, you're wrong. Every single data point is required to be submitted to the regulator. So I submit all that data, my regulator sees it, they can act on it. The 90th percentile, what was set in the regs, that's the global number to compare to the action level. But every single data point needs to be submitted by law and needs to be done in a certified lab.
But for a city, whether they exceed or meet, it goes by the 90th percentile, not the individual homes.
And when you report in your annual water quality report, you have to say how many are above that and how many are below it. Mm-hmm. So the citizens have that information, regulators have that, the water department has it. Choosing any number, when we say we have to report the average for some contaminants over multiple samples, that means we report one number, not the whole range. What I want to say is we need to be thoughtful about folks using information, using the data, and not focusing as much on...
Right, but when we talk about what's the weather like, people just remember the average and remember what's the single number that's reported. So I'm just making a comment.
Well, so you can see even from this discussion that this is the kind of thing where quote unquote reasonable people have come up with ways to deal with reasonable ways of looking at the data. But I think that the public is unhappy with a lot of this. And I would actually urge all of you to get engaged in this issue and to think about exact numbers and stuff like that. A lot of the decisions that have been made about what gets reported and the 90th percentile and stuff like this may not stand to our current concerns or the advances we now understand about lead exposure. Just want to make the point that it's not just the kids. It turns out there's pretty good data now that cognition of adults is also affected by lead. So if it turned out I worked someplace with lead, as I did in a steel factory when I was a kid, had a lot of lead in it and so forth, it's in my bones. And I'm going to get a little bit more demented a little bit earlier because of my lead exposure when I was young. in addition to whatever hypertension I might have that might have been contributed to. So it may not be in an individual that it makes you hypertensive as opposed to not hypertensive. But if you look at 1,000 people, the whole thing shifts a little bit. And the same thing with cognition. So this is really an issue that affects all of us.
Yes. We are going to move on from statistics for just a moment, and we are going to move to our Q&A segment. We are pleased to have in our audience Ronnie Levin of Harvard Chan's Environmental Health Department. Welcome. As a former analyst at the EPA, Dr. Levin played a crucial role in the agency issuing historic standards for lead in drinking water. Dr. Levin, if you could start us off on our Q&A with just a question or a comment, that would be great.
Thank you very much. So there's a lot of talk about the lead pipes, but in fact, in Flint, it was the same number of lead pipes the day before and the day after. The issue is the water. It's whether treatment is being done, whether it's being done well. And the focus on lead pipes is a bit of distraction to point fingers at others that you may or may not control. The only measure that really works is the lead level in the faucet in the house, and that needs to remain the compliance measure. That's what the utility gets their feedback on their program, their treatment, and that's what people find out their risk. We can't move away from that. Just FYI, both the enforcement programs and the lead programs have been eliminated from EPA's budget proposed in 2018. And finally, Steve, this is from the Boston Globe last year, the 16, in 2016, and it says communities with at least one home that's above the action level in 2015 were Boston, Meldon, Melrose, Milton, Newton, Somerville, Stoneham, and Winthrop. One Malden house had 600 parts per million. I think that there's room for improved corrosion control.
Thank you, Dr. Levin. We're going to take some online questions right now, and I think Lisa is going to cue those up for us.
I do. Thank you, everyone. And Moitre, this is actually a question for you. It says, I read that lead exposure can be passed down through the generations and that it results in epigenetic changes that can be seen in the children and grandchildren of those exposed. Is that true?
So I think when we talk about generational changes, I think there are, the way that Eric had proposed it, that there's lead in women's bodies that gets mobilized during pregnancy, and so infants who are exposed in utero can have very high lead exposures from mothers who are exposed to lead, and that is happening at a potentially very vulnerable time in brain development, which is during pregnancy. And so there's certainly that, and I agree with that. And I think the science of epigenetics is a new one, and one that is that we're learning a lot more. And certainly we've seen that there are epigenetic changes that are related to lead exposure. I don't know that we have the science yet to say that those particular changes that we've observed we can relate very strongly to cognitive outcomes. So I think we're not quite there yet in making that connection.
Thank you. Thank you. Actually, I'd like to take this one because the mayor's office from Lansing, Michigan is sending a comment. And we were talking about that. Greetings from Lansing, Michigan, where we removed our last active lead service line last December, a 12-year, $42 million project. What are the prospects for much-needed changes in the LCR to address flawed first-draw sampling techniques and using the 90th percentile as the standard for compliance? Because lead is a zero-tolerant toxin for children, shouldn't we do more to protect the 10% of the households that can test far above the acceptable action level while their water supplier gets a passing grade?
Great question. From somebody who's
Thank
actually
you for
done
watching, Lansing.
done some great work. I would say, there is room. EPA is in the process of revising the rule. They've been at that for 13 years now, slowly getting towards the finish line. We hope that they'll get there. There's a couple pieces. One, I think the recognition, we talk about pass, fail. We don't pass and fail the lead copper rule typically. We exceed or don't exceed a level, which requires additional action. One of the things that's been recommended by the National Drinking Water Advisory Council, I served on a working group with that, is to say that rather than using this above, below to push action, that those actions should occur continuously in every system. So right now, mandatory lead service line replacement, as was accomplished in Lansing, is only required for systems that are over the action level. The NDWAC, the National Drinking Water Advisory Council, suggested that every system should be removing all their lead services over some period of time. There's some debate about how long and how that would be done. And that our goal should be recognized as moving towards zero. It's difficult to get to zero, just as it's been difficult to get to zero in children's blood lead level from lead paint. There's still plenty of homes with lead paint out there. But taking every action we can, water, paint, dust, to move in that direction. Interestingly, the American Water Works Association, our trade association, fully endorsed, their board voted, the first time that they voted to fully endorse a recommendation of this type. It's been movement from let's do corrosion control to finally let's get all the lead out, reduce that risk. And Dr. Levine's comment, the thought that lead service lines are a distraction is in some ways misguided as well. If we had had failed corrosion control and a change in source in Flint and there were no lead service lines, the lead burden those children received would have been much smaller. It's like that bit of Swiss cheese. You needed to have both the lead service lines and the failed corrosion control to have that dramatic increase. So we need to do both. We need to do corrosion control, need to continuously work on that, not be satisfied, but we also need to get the sources of lead out.
Thank you. I'll do one more online, just so I know we're running a little bit late, and we'll see if our audience here has any further questions. Here's one. I was extremely disturbed by the recent Reuters article about lead poisoning in California, including areas of Fresno and Oakland where lead levels among children were as high or even higher than in Flint. How much of that was due to lead in water, and how common is this scenario across America? I was stunned at what I read.
I think that that's a really excellent comment, because what's happening is coming out of the woodwork are many stories which have not been as well documented as Flint because of the notorious kind of aspects to it, and what in many people's view is criminal negligence by the people who are running the city. And what we're seeing is that there are places where lead levels in children are higher than Flint, and where long-standing problems have existed, and again, no investment in infrastructure, no interest by the political infrastructure, little knowledge or awareness by the public to help drive that kind of process. So I think that actually Flint is only emblematic of a really big problem that we have, and we don't have good idea about how extensive this problem is. We can certainly say things like, well, if your house was built before a certain point, then lead pipes may have been used, and therefore you're at high risk compared to a neighbor whose house was built in 1980 or something like that. But then again, the issues of other places where people get exposure, either the workplace or schools, for example, that may be older and things like that. I just think there needs to be a mapping of this. We need to do this probably in some kind of a combination between governmental bodies as well as kind of crowdsourcing in terms of what's going on, levels that people are detecting and things like that. It's very disturbing. The stuff from California is just like, oh, you don't want to read this, it's so bad. But I have heard about this from Cleveland, the number of middle American states, if you will, and not just the ones that are on the East Coast or the West Coast. So I think that I'm going to get back to this point about leadership. We need leadership. Now, most politicians are behind the people, they're not in front of the people. So again, I really urge all of us to get in front of the issue and make it something so that there are some resources to go. Even if you're only mapping your schools, you know, that's still a major place of exposure.
Yeah. And that's actually what Toxin Alert does. We, in addition to mapping homes, we have a Safe Water for School campaign where we want every single school in America mapped. So we have 130,000 schools. And I think, again, until the government gets their act together, whether it's EPA, state, or local government, I think we have to take the data and our own leadership and our children's health into our own hands and really be personally aware, you know, all the different ways to minimize exposure, find out your own, and be alerted whenever new data comes out that tells you water in your school or your restaurants near you or have high levels of various lead or other contaminants such as arsenic.
Yeah, so everyone test your water, send it in. I'd love to take some questions from the audience. Does anyone have a question they would like to ask? Yes.
I'm curious as to whether there's geographic disparity in the U.S. according to rural or urban residents, and is there bias in our knowledge of whether there's a disparity because perhaps maybe rural areas are less surveillance than others?
Absolutely. This disparity is actually huge because the wealthier cities and towns can afford more testing, and while the rural areas cannot. And so Flint is one of those emblematic issues. It's also a Rust Belt city. But in addition to that, again, as I mentioned before, there's 4 million Americans who completely are out of the water systems, zero testing whatsoever, because they're dependent on wells, and wells have almost very little testing whatsoever. And for small communities, even if they are tested and managed and have to follow EPA regulations, some of them are so small they're tested once every 5 to 7 years, which again completely falls off the radar in terms of managing or being alerted to hazards. So, and again, testing costs money. It's not that expensive actually, especially if you consider the number of children who goes to each school. It's pennies per children, and I think the long-term corporations and other sectors besides government need to step up and say, look, this is important for our children and our children's children, that we should, maybe corporations should consider sponsoring the more low-income areas that cannot afford these tests to really fill in the gaps that EPA and other cities cannot fill.
Definitely. I think we probably have time for one more question. Do we have one last audience question? Don't all jump at once.
I do have an online question, plenty that are coming in that we can take. And this is about schools, actually, that just came in. Will replacing fixtures actually solve the problem of lead in schools? What about plumbing replacement if the lead is leaching from pipes leading to the fixtures? What is the actual magnitude of this problem in terms of schools affected and potential cost to fix?
There's really interesting data about this because we've identified, for example, the bubbler. And the bubblers used to have lead lines that went from,
lead tank.
Yeah, exactly. And it would come, so the kid would be drinking lead, super duper stuff. But so if you look in the New York system, for example, what has been found is that sometimes there are very high lead levels that are found, and that's because there is a lead line going to a bubbler, to a series of fixtures and so forth, and someplace else it's a different kind of pipe. This brings out the question then of, that you need to map the whole thing. You can't just go test 3 bubblers or 3 fountains in a school that's got 10 or 20. You really need to do each one. And what's been found is sometimes there is lead and sometimes there isn't. And so the kind of answer to that question is that the questioner is very accurate to be concerned about lead lines in schools as well, and the only way to find out about that is actually to do testing.
Yeah, maybe add to that slightly. One, yes, the pipes in the wall can contribute, and that's not just the fixtures. And that's why a number of systems are now looking at installing appropriate certified filters that will remove lead in school fountains. as a measure, because if you think about a big old school, trying to replace all the plumbing is a huge effort. And just in terms of environmental risk, those walls probably have lead paint, and they probably have asbestos and 7 or 8 other things going on. Any renovation in a school is a big deal. So some of the schools are saying, let's replace the fixtures, and we'll kind of belt and suspenders this new fixture and the filter. That reduces the risk that the lead plumbing in the building, lead solder in the building could be contributing. So it's interesting from a regulatory perspective, but we're getting there.
Thank you.
To add to the buildings, I think when people think of buildings, you should also think of your own homes that you buy and rent.
Yeah.
Because when you rent and buy a home, you ask for a lead paint report, right? It's required by the landlord to hand over to the tenant. But no one ever asks or does an inspection of what is the lead levels in the pipes and of the water that comes out of the home. And I think when people buy homes, rent homes, that should actually be the new question, not just the lead paint, but what is the lead in the water that in their home?
Absolutely.
And we could have another whole forum just on that, but we are going to wrap up here. So each of you, I'm going to ask that you finish by clearly identifying a policy takeaway on the subject. And Jeffrey, would you like to start?
Sure. I'd like to say that I think the magnitude of this lead problem in water is big, that every time we lift another rock, it looks a little bit worse in terms of how this is. We see lots of granularity, e.g. some places are fine, other places are terrible, and stuff like this. I think this needs to be part of a national debate. And I think that Flint is great, and I think it's wonderful that the political class decided that we're going to help the people in Flint, but the people in Flint are not the only people at risk here. And so I think that what needs to happen is there needs to be people who say, no, we're not going to stand for dismantling of the program that's supposed to be looking at lead, and I don't think that we need to be kind of ignoring this. We need to devote some money. What I'm used to saying to people is, again, if Al-Qaeda dropped, lead into our water, we'd be all over this. So guess what? Pretend Al-Qaeda dropped lead into our water and we want to find out how bad it is. Let's make it part of, that kind of an assessment. Think of it in a different way. And this is permanent damage to your kids, your grandchildren, and by the way, you're going to get demented a little bit earlier too. So this is no joke. This is really everybody, and if you care about your kids and yourself and your spouse and all that kind of stuff, then this is something that you should elevate, and politicians will react to this. And if we make it, again, a public health issue and not a political issue, I think we're a little bit more likely to see an appropriate degree of movement on this.
Thank you.
I'll second Jeff's comment, and I'll say another thing that the NDWAC, the National Drinking Water Advisory Council recommendations push for that I think is critical is better coordination at the federal and state level between the various risk programs. Right now, here in Boston, city will spend $30,000, $40,000 removing all the lead paint in someone's apartment that has a child in it. They're not allowed to spend a nickel on removing the lead service line. They will tell the homeowner that the home has been de-leaded. They will certify that the home has been de-leaded, and they can leave brass fixtures that have lead in them and a lead service line and not even test the water to say, well, you've got it, but it's not a problem. Simply ignored entirely. Coordination across all these different exposures is the only way that we ultimately solve the issue of exposure to the child. We can talk about where the lead is, but it's how that lead then gets to the child that we need to worry about.
Absolutely. Eric?
And I think for my perspective, it's really about public knowing what is their lead in their home, in their community, their schools, the restaurants that they go to. And if you don't know, find out. Oftentimes, many city offers a free testing if you request it, or conduct your own certified laboratory testing. And I think also for the rural cities in America, we really have to focus on them because these are our future generations. And I think we cannot just let them live in the darkness of this black box, Wild West. We have to increase testing and awareness there. And when you rent and buy a home, please ask for it to be part of your inspection. So what is the leaded water situation in the home, not just the paint?
Thank you. Moitre, do you have a policy takeaway that you'd like to add?
I think the one thing I would try to bring back into this discussion is this is something that affects everybody, but it affects some communities more, and we already know that. There are already communities that are more vulnerable, and those children have multiple threats to their health, of which lead is just one. And what's the policy takeaway is for the children who are exposed to lead, they should not also then be exposed to poor nutrition and a lack of educational opportunities, early education, and preschool education. I think we have a responsibility as we're sorting this out to make sure that we don't further put these children at risk, and that we invest in all of them.
Thank you. This concludes today's panel on lead-contaminated drinking water and children's health. Thank you for joining us. We encourage you to continue the conversation on the forum website and at forumhsph.org, and to watch the next forum on the opioid crisis. That will be May 5th at 12:30 p.m. Thank you.
If you are interested in supporting this program and others like this from the Leadership Studio at the Harvard T.H. Chan School of Public Health, please call 617-432-1318 for further information.